Okay. And then what I'll do is I pull out the link and I post it right underneath the handout in Moodle. So this way, when you go back and if you want to review something, you could always go to that link. So we pull the videos out of Zoom and we put them in a YouTube page that we have for the program. And we make our lectures unlisted or private. And we'll typically unlist it so that you're able to see that. And all you do is click on it. It takes you to YouTube, and then that's how you'll watch it. I'm sure you've had a recorded lecture already or something. I don't know. Okay, so blood collection. Let me get started. This is equipment and some techniques that we need to employ when we're doing phlebotomy. So obviously, when you're doing phleb, you do need a drawing station. So you'll see in all of, I mean, I'm sure you've gone to the doctor's office in the area where they draw your blood. There's a little bit a chair that has an arm in it, and or some sort of a drawing station, right? So there's always like a drawer with all the supplies, and then you have the phlebotomy chair, which has the adjustable armrest. Phlebotomists usually use these little carriers here where they have compartments. They can put all their supplies in there. If you're in the outpatient lab at Valley, they have carts in place. But if you are a phlebotomist that's going around the floors, you probably have a cart, and you have this little carrying case that you take with you everywhere. It's either one that's closed that you can close, or an open one that you can just sort of carry around. So you put all your supplies in there. Carts are typically the ones with the drawers, and you can store everything in there. So the tubes, the gauze, the bandages, gloves, any hand sanitizers, anything that you need before the procedure. So we have to use gloves. Sometimes we use liners underneath. If you have some sort of latex, if you have some sort of latex allergy, you should let us know, because then we can get you some liners that go underneath, or we can get you non-latex gloves so that you don't have any allergies or you don't get itchy. We've had some people, some students who just immediately get a rash from the latex gloves. So just let us know, and then we can get you those. Excuse me. And so these are required. You must wear gloves when performing phlebotomy, and you need a new pair of gloves each time that you have a new patient, or if you get them dirty or if you get blood in them, then you must change your gloves. Okay, we have lots of gloves, so don't worry about wasting. You're not wasting. We would rather you be clean and safe and use your your aseptic techniques instead of reusing gloves. So never ever reuse your gloves. Make sure that you have a good fit. The liners are good for any types of allergies or rashes that you may get. And also you can use some hand barriers, like some lotion, if your hands tend to get very dry, because we wear gloves a lot. So our hands tend to get a little dry, not only the gloves, but also because we're constantly washing our hands when we take off our gloves. Okay, so always carry a little hand lotion with you so that you can moisturize your hands. These are some glove liners and some soft card barrier and cream that you may use so that your hands don't dry out. We use antiseptics. Antiseptics are the chemicals that people apply to the skin. They obviously they help reduce the number of microorganisms living on the skin, in wounds, and also in the mucous membranes. So there's different types, and they vary in cost, effectiveness, they vary in uses, and also in some potential side effects. So it just prevents microorganisms and other toxins to get into our blood, into the patient's blood, or your blood, obviously. So we typically use 70% isopropyl alcohol for most of our common routine blood collection, and that's safe to use in human skin. Disinfectants are a little different. Disinfectants are the ones that we use for the surfaces. So if you have a workstation, you're going to disinfect the workstation. So we use antiseptics for the skin and disinfectants for the working station, right? So the desk, the chair, the arm of the chair. And hand sanitizers, you're also allowed to use hand sanitizers, typically alcohol-based rinses or gels or foams as well. And if you can use them if your hands are not soiled, if they're not dirty visibly, if they don't have blood in them, obviously you can quickly just use hand sanitizers if you're not able to wash your hands right away. We always have hand sanitizers on the near the stations. So you'll see a lot of these hand sanitizers all over the hospital. So be sure to use them all the time. You'll need gauze and pads or cotton balls. Typically, we use gauze to protect the wound right after we do the incision with the needle, okay? It's like a small little square gauze. It's folded into 4 pieces, and it's really to just hold the area after blood collection. You don't really want to use cotton balls because cotton balls will stick to the skin and it gets like all the little hairs in there, so you don't want that. We don't use cotton balls. Bandages, you can use anywhere from the tape bandages or the band-aids, basically. So we get that ready, and then you can put that. Sometimes you may need a microscope slide, but we don't really do any kind of slide prep when we do phlebotomy. That's more of like once the blood gets into the lab, then you may need to do may need to prepare some slides. So don't worry about the slide situation. So here are some examples of the sharp containers. When we do phlebotomy, we usually have like a small container that is right by your station, or if you're doing it in patients' beds, if you're going around, then it's probably on your car. But it's very important for you to have this sharp containers because you are going to dispose of the needle immediately. Okay, so the needle and the safety devices, the needle and the tube holders, okay, are going to go right on this sharps container. You are not to reuse any needles, or you are not to like put them on the desk, put them on the patient's bed. We can't do that because that puts the patient and yourself at risk for a needle stick, for an accidental needle stick. Okay, tourniquets, you've seen these before, I'm sure. So these were like the rubber devices that we put around the patient's arm to restrict the blood. And so basically what happens is that it restricts the flow and it inflates the vein. But it doesn't inflate the arteries, okay? So the vein will pop up a little bit, and so that you can visually see it sometimes, and then you can feel it. You can palpate the vein, and you can actually feel it, okay? So these are like stretchy tourniquets. I like to reuse my tourniquets. These are disposable, so you can throw them out after you use them on a patient if you don't feel comfortable using them again. And then here are your needles, okay? So we use 2 types. The common needles are the straight needle, okay, or the small butterfly needle, which I'll show you in just a little bit. So needles are sterile, okay? They are disposable, and they are designed for a single use only, okay? You are not to reuse any needles. These could be multi-sample, which means what that means is like, well, if I have one needle and it's going into my patient, I can collect various tubes from that needle. They are hypodermic, and also we have the butterfly or winged infusion needles. So here's some parts of it. The needle obviously has the sharp edge on it, right? And that's kind of like an angle shape. It has a little hole inside of it. That's called the bevel, okay? And that's important because that's where the blood will flow through. Then you have the shaft of the needle. You have a hub, okay, a threaded hub, and that's where you screw in the tube holder. And then you have in the back or at the bottom of the needle, you have a rubber sleeve over the back of the needle. So the needle is like sharp on both edges, but there's a rubber holder that keeps it from being so sharp, but it can still be sharp, okay? So we have to be very careful. And this is an example of a multi-sample needle. So a needle like that, that's what we call a straight needle, okay? Needles have gauge, okay, so that's basically the diameter of the lumen of the needle. So the higher the gauge, the smaller the diameter of the needle. So, for example, they can go from 20 to 23, but the most common needle gauge that we use is 21, okay, so it's like in between. But the higher the gauge, the smaller the diameter of the needle. So the lumen of the needle gets a little smaller, okay? So you have 20, okay, or 23. So 20 would be a 20 gauge would have a bigger diameter of the needle. And they are color coded by the gauge as well. But again, the most common gauge that we'll use is 21. They say the lower the gauge, the more it hurts the patient, but I don't know, I can't really tell the difference. Some people get more pain when they use the butterfly needle, and some people get more pain when people use the straight needle. So it really depends on the pain tolerance of the patient. So the length of the needle is usually 1 to 1.5 inches in length, and that's what is the most common length in venipuncture. So here are some examples. So these are the straight needles. So let me just go back of this picture. So that would be a needle that comes on its own with nothing, no protective device on it, right? But now needles come with a protected device. So this would be a protected device, a protective device. It's called a safety feature, a safety hold, a safety cover, okay? So basically, you could either purchase the tube holders with the safety device and just use the stray needles. I'm sorry, my left hand is like so hard to control. Or you can purchase the needles that already have a safety device on them so that you can close it right away as soon as you're done with your patient, okay? So some needles come with everything together, tube holder, activation device, safety device. So these, you can press a button on some of them and then it automatically retracts the needle. So that way it protects you and the patient from an accidental needle stick. So there's different types that you can buy, but you would always want to be able to use them with a safety device to cover that needle as soon as you're done. Because we just don't want to have needles exposed or, everywhere and all over the place. You don't want that because it's easy to accidentally puncture yourself with a needle. Okay. So, we use in phlebotomy something called the evacuated tube system. So the evacuated tube system is just a system of tubes that have been manufactured to help with the drawing process, okay? And well, they come in different colors, different anticoagulants, different chemicals that are added into the tubes. Some of them have none, some of them have some chemicals that have been added. Now, the evacuated tube system is actually a closed system. The blood comes in through the needle that gets inserted in the vein, and then it goes directly into this collection tube. So there's no air that is getting involved here, okay? It's the only thing that is happening is that there's a vacuum system that is drawing the blood out of the vein, okay? So it's good because it prevents exposure to air or possible contaminants, and it has it allows you to use multiple tubes, many tubes that you can collect with just one venipuncture. Okay, so ideally that's what you want. You don't want to stick the patient 10 times to get like 10 tubes, right? If you need 10 tubes, you don't want to do that. Why? Well, because there's a lot of risk of injury. Patients, depending on the situation, sometimes they're getting stuck once a day, sometimes they're getting stuck once in a while, but then it hurts. Some people are afraid of them, okay, afraid of needles, and so it's not always an easy process for patients. I never heard of someone saying, I enjoy getting my blood drawn so much. Nobody likes it. So it's this system is nice because it allows us to be protective, allows us to draw blood in the correct way and get multiple tubes out just out of one needle stick for the patient. So the ETS is basically the multi-sample needle, which you will need, whether it's a straight needle or a butterfly, a tube holder, okay? So it comes with a little plastic, I'll show you in the next slide, and the evacuated tube. So I'll show you here. This is the traditional equipment that you will be using. So this is the needle, the straight needle that already comes with the safety device, with the safety covering. And then this is a tube holder. And this is your evacuated tube, okay? You put that all together. So you screw the needle in first, you put this safety device to the side, and then you have your tube that goes in, okay? The tube doesn't quite go in until it's actually inside of the vein, okay? We kind of just superimpose, we just kind of put it like lightly inside of the tube holder as we're going in, or you just go in with the tube holder and the needle, and then you put in the tube. This is an example of the needle, the straight needle that does not come with the safety device, with the safety covering, but the tube holder comes with the safety covering. Okay, so if you have these straight needles, then you grab one of these tube holders with a safety cover on them, or sheathing cover, a sheathing device. Okay, and then here's the tube, and it's the same thing. So it just depends on whatever your facility is buying and you know what kind of supplies they are using. So we use typically the multi-needle samples, which the straight needle, the double pointed needles, they are very sharp, but the back of the needle has the rubber on it, so it's not as sharp, but it has to be sharp because it has to pierce through the tube. Remember that, okay? So you have two sharp edges. And then you have your tube holders. Your tube holders, again, can come with a safety feature or no safety feature. Sometimes we can buy the needle and the holder units together, and they are permanently attached. It depends on what they're buying. Okay, so the evacuated tubes, okay? These evacuated tubes are use with both the evacuated tube system and also the syringe method. So you may need to draw blood with a syringe, and for that, you can still use the evacuated tubes. They're available in different sizes and volumes, but the size really depends on the size that we use. It's going to depend on the volume that we need, the age of the patient, the condition of the vein, and also they can be plastic or they can be glass. Plastic nowadays is preferred because glass can fall down and it can break and it can splatter everywhere, but plastic won't do that. So we don't really use a lot of glass tubes anymore. We've gone out of that and we use lots of plastic. OSHA regulations require that tube holders with the needle attached is disposed of as a unit after the use and never be removed from the needle and reused. So basically what that's saying is that you have your tube in your tube holder, you're going into the vein, you're drawing blood, you're getting all the tubes, you're getting a nice flow, you mix the tubes, you put them down, right? When you're done with that venipuncture, you remove the needle and the tube holder together, okay? You activate your sheathing device, your protective cover on the needle, and you dispose of the needle and the adapter, the tube holder together, okay? You dispose of that together and you put it in the sharps container. Okay, so it's mandatory, basically. You are not to unscrew them and then put them on the sharps container. Okay, so what's an evacuated tube system? Well, the evacuated tubes just have a little vacuum, okay? So there's negative pressure that artificially is created by pulling air from the tube, okay? And so the reason why we have that is because it could draw, once we go in the vein with the tube, it helps us extract the exact amount that we need into our tube. And why do we need a certain amount? Well, sometimes we have an anticoagulant in the tube and we need to have a certain ratio of blood to anticoagulant, okay? So, and also maybe depending on the testing, you can't always just send just a little bit of blood and then you'll figure out what to do with all that blood. No, if we're running certain tests, you need to fill your tubes to the line that is indicated in the tube. And there are huge purposes for that, okay? Maybe because the tube is going to a certain test that will use a lot of blood, or that tube is being used for multiple tests. So you need enough blood. Now, if you're drawing blood, you give the lab professional just like halfway through, what's gonna happen? Hey, Q&S, quality not sufficient. I'm not able to run this test. And guess what? You have to get the patient again, see if you can draw them again, and then do it all over. So you want to fill your tubes to the top, okay? Even if your patient is uncomfortable, even if your patient has like an attitude or the worst face ever because they are just not happy, okay? You've gotta make them wait and make sure that, but the vacuum system, that's what it's there for. It helps you draw the exact amount that you need, okay? All right, so I'll go over these, but we have different additives that go into the tubes. Some tubes have nothing, no additives, no substances, but most of the time there's something in the tube that you'll need, okay? Depending on the test, depending on the tube. We use our evacuated, our tubes, we recognize them by the color of their stopper. And by the color of the stopper, which is the top, then we know, we're like, oh, okay, you have EDTA, you have sodium citrate, you have fluoride, sodium fluoride in there, okay? Potassium oxalate. So they're all different, okay, depending on the color. So this may be a little bit tricky because some of them are a little confusing, but you'd have to learn them just for this class, obviously. But eventually you don't really have to, it's always like you learn, you kind of memorize them after a while. But then also when you're doing phlebotomy, you always have a color-coded chart in front of you, so you know exactly what you need to draw and what those tubes look like. But for this class, you do need to learn them and memorize them. But I'll show you some techniques that we cannot use. Okay. So color coding is going to be very important. So it indicates type of additive. And also always check for the expiration dates, because if your tube is expired, that means the additive be expired and the vacuum system is expired too. In the lab, when we do our phlebotomy practice, I use a lot of expired tubes, so it's okay. We'll do, because we're throwing them out, whatever, we're using them for practice. But with your patients, you are not to do that, okay? So you always check the expiration dates. So here's here are two images of your evacuated tubes, color coded. Most of them are plastic now. So here you are. Here's the sodium citrate, a yellow top with the gel separator in the bottom. We'll talk about what these all mean, okay? Red top tube, green, light green, there's light green, there's purple, pink, gray, there's blue, royal blue, there is marble colors, there's a lot of different ones. Okay, syringes. Well, you may need to, we don't draw ourselves in the lab unless we're doing blood gases and things like that. You're not really drawing with syringes, but you will learn about them as well. So this is just an alternative for patients that have very difficult and small veins. So they may use a syringe to just draw the blood, and then they can put the blood in the syringe back in the evacuated tube system. The syringes usually have the barrel and a plunger. So the syringes will also allow us to transfer into a tube, but you'd have to use the tube holders to attach that to the tube. Some examples of syringes here. And then your winged infusion set, which is the butterfly needle. The butterfly needles are great. I love butterflies. I'll teach you how to use butterflies as well. But your primary needle is going to be the straight needle. So that's what you're going to use, unless you have a little patient, like someone who is young and they have small veins, or maybe an elderly patient that has very fragile veins. You can use the butterfly on them. Or if you have somebody who's really scared of those big needles, you can say, hey, I'm going to use a baby needle on you, right? So it's just like they don't get as scared anymore. But butterflies are available as well. You may use them depending on the situation, but mostly on the elderly and also on pediatric patients. So butterflies are basically smaller needles. They are about 23 or 25 gauge in size, and it has tubing attached to it. So it's like it's a little needle. It is called a butterfly because it has two wings. Okay, and these are wings that you can hold. So you hold on to the wings and you make the incision with the needle. Okay, and then you can let it go. And when you let it go, it usually stays in place. Okay. There's two types. There's the lure attachment or the multi-sample lure adapter that you can use with that. And it has, again, the wings, the plastic extensions. It's for easy manipulation and for getting a good angle into that vein. Okay, and they also require safety devices to prevent accidental needle sticks. So that's an example. So on the left, you have the lure adapter, and then you have the syringe method. But the typical one is you get the butterfly needle out, and then you have an adapter attached to it. So this adapter is where we'll hold the tube, right? And so you have the tubing around it. So now the tube has some air in it. So depending on the test, we may have to draw one tube first and discard that tube, and then use our second tube. Okay, I'll talk about that in a little bit. But here it is, and this is why it's called the butterfly, and that's because you hold on to these little wings right here. You use them to make the incision, and then you can let it go. And this yellow part right here is the safety device that you will activate by moving forward once the needle is out of the patient. Okay, because you want to protect the patient, protect yourself as well. There's also some combination systems for blood collection. You have the blood collection tube and the collection apparatus are all combined in one single unit. We don't really use those, but I'll show you an example. So this is the SARTET-S monovet venous blood collection system. It's just an enclosed multiple sampling blood collection system, and basically everything is together. So the tube is already attached to the needle. Okay, so basically put in the needle, take it out, activate the device, and then you can detach the needle from the tube basically. Okay, we don't use those, but I guess some hospitals can use them. They're compared to like syringes basically. They have other tubes with additives in them. Okay, but so this would be in a place of a syringe. If you say, well, I don't have a syringe, maybe we can use this system. So what it does is really it avoids the transferring of the blood in a syringe into a tube, where you're basically using a syringe here right into the tube system. Okay, so let's talk about some of the chemicals that are in these tubes. So we have some additives. One of the main additives that you'll see are the anticoagulants. So anticoagulants are substances that just prevent coagulation of the blood, because the blood will clot. If you let it clot, it will clot. Okay, and so when it clots, you lose a lot of proteins that you're looking for sometimes in the blood, right? Because we're testing the blood. So there are certain tests that we need to add a little anticoagulant in there because we don't want our blood to coagulate. Sometimes we want it to coagulate, sometimes we don't. So here are some, there's different ways of coagulation, of anticoagulation. Some of them precipitate calcium. Calcium is a big factor of coagulation. And some of them inhibit a protein called thrombin. Thrombin is another big factor in coagulation. Okay, so basically, these systems they just help, and they bind certain proteins that will help the blood coagulate. So this way it doesn't happen. And here are some types. You have the EDTA. Okay, well, this is one of the words that I don't say. There's going to be some words that I'm just going to tell you, I'm going to give you the abbreviation for, because I know I'm going to butcher the word. EDTA, okay, is one of the big main anticoagulants. Citrates, heparin, oxalates are some of the other ones, okay? And they all work in different ways, but they're basically doing the same thing. They're just preventing the blood from coagulation. Now, when you have an anticoagulant already in the tube and you collect the blood using that tube, you want to make sure that you mix immediately after getting the blood out, right? So even if you have multiple specimens that you are collecting, okay, you take the blood out and then you use one hand to mix. So the mix is 1, 2, and 3. When you go 1, 2, okay, that's one inversion. 1, 2, that's one inversion. Okay, so certain tubes are required to be inverted like 3 to 4 times, maybe a little bit less, maybe a little bit more, depending on the tube and the anticoagulant. But if we don't mix that anticoagulant in, then it's like you never used it, right? So we want to make sure that we mix that in. But it's a very gentle mix. You are not to shake the tube vigorously, because if you do that, you're going to hemolyze the blood. You're going to hemolyze the cells. And so that's going to cause a whole nother issue, okay? So multiple inversions are required, and the numbers vary by manufacturer and the type of test. So here's an example of a sodium citrate tube. The anticoagulant, this is a light blue stopper. The anticoagulant in here is a sodium citrate anticoagulant. Sodium citrate, it's a type of anticoagulant that binds calcium, and so it prevents coagulation. This blue top tube, this light blue top tube, must contain a 9-to-1 ratio. So basically 1 part anticoagulant and 9 parts blood. Okay, so we have designated lines in which you will see where your blood needs to go to, where the blood needs to go to. So there's a max, mid, and minimum. Okay, this is a different size tube. So you follow the tube volume as well. Okay, the arrows for these types basically indicate what is the correct amount of blood that you must fill up to. Some special anticoagulants are acid citrate dextrose, citrate phosphate dextrose, sodium polyethanol sulfonate. We also use some anti-glycolytic agents, and these are agents that prevent glycolysis. Glycolysis is the breakdown of glucose by blood cells, okay? Sometimes we want to measure glucose, and so we don't want it to get broken down. So you need those types of anticoagulants. Sodium fluoride is actually the most common anti-glycolytic agent. And so it prevents the breakdown of glucose, and it preserves glucose for up to 3 days, and also inhibits bacteria growth. Because if bacteria grows in the blood, it'll start basically glycolysis. So it'll break down glucose. You may also use sodium fluoride with potassium oxalate for a rapid anti-glycolytic response. We also use clot activators. These are substances that enhance coagulation in serum. So now we want our tubes to coagulate, okay, in the serum. And so these are clot activators, okay? Some of them are are in the tube. Well, they're all in the tube, but we can use substances that provide more surface for platelet activation. So things that provide platelet activation for coagulation are things like glass particles. They activate the coagulation cascade, so coagulation occurs. Clays like cellulite, they also activate coagulation. So these are some clot activators that you can use in order to coagulate the blood if that's what you need to do. So we put that in those tubes. We have the thiotropic gel separators, and these gel separators, they have the a density between that of cells and the serum or the plasma. So when you centrifuge them, the gel in the tube moves between the cells and the serum or the plasma, depending on the tube that you're using. So it's a gel separator. So it prevents the cells from continuing to metabolize certain substances. And we also have some trace element free tubes. And these are tubes that are made of materials free of trace element contamination. We typically use these types of tubes for tests that we use in toxicology studies or nutrient determinations, and they're usually the royal blue stopper tubes. Okay, so here's some examples. These are also in your book in color. And if you have a color printer, if I was giving you this lecture in person, I probably would have printed this in color for you, because I like the students to have these in color. But if you can print, if you don't mind, print this out and have it in front of you, so you can have this chart with you when you do your phlebotomy practice and when you're doing your rotation. But otherwise, if you can't, I will ask Marietta to print copies of these charts for us, so that way they can be in the classroom. Okay, so now we have the different types of stoppers that tells us the different additives that are on them, okay? And the kind of body fluid that we're trying to get by collecting blood, right? Because sometimes we're looking to just test the serum. Sometimes we're looking to test plasma, okay? Sometimes we are looking to test the whole blood. Okay, so it just depends on the test and and what we're looking for. So the red color stopper, okay, usually has a silicone coated glass, okay, and no additive. And what you are collecting with those is a serum, okay? And serum can go to blood bank chemistry, serology. It typically takes a good 60 minutes to clot, okay? So no additive, no anticoagulant, but some coated glass. So the coated glass can activate coagulation. The simple red plastic tube can have a clot activator, right? It's in a plastic tube. And these little asterisks that you see are basically the amount of times that it should be inverted. So for example, this one has 1 asterisk, so it should be inverted 5 times gently, okay? So this would collect serum, possibly going to chemistry or serology. It takes about 30 minutes to clot. The red and black tube, or the gold top tube, typically has a gel separated and a clot activator in there. So you want to clot the blood and you want to separate the cells from the serum. Okay, so serum will go to chemistry and serology. The lavender or pink usually has potassium EDTA. That's an anticoagulant, okay? There's typically a spray with potassium EDTA that is sprayed, that gets coated inside of these plastic tubes. So you're collecting plasma, typically for hematology. The anticoagulant, so here's what I want you to, I'll talk about this again when we do this in coag, but the anticoagulant, so if you let the blood if you collect the blood with an anticoagulant, okay, and you spin it down, you separate the cells from the liquid part of it, right? So you could either get plasma or serum, right? But plasma basically is when you are collecting in an anticoagulant, okay? So for example, in a lavender tube, which has an anticoagulant, or a light blue top tube, which has the 3.2 sodium citrate, that's an anticoagulant. So when you spin it down and you separate the plasma, right, or the liquid part from the cells, then you're getting plasma, okay? Because you're not allowing the cells to clot. So there's different proteins that are there. Okay, there's the green with a sodium heparin, that's an or lithium heparin. Usually whether it's sodium heparin or lithium heparin, that will say it in the tube, so you can actually read it in the tube, okay? That typically goes to chemistry, or maybe hematology for hemoglobin. There's also a green gray or a light green with lithium heparin and gel for plasma separation. So when you need plasma, you could do that. There are the gray top tubes. There is one with sodium fluoride, which is the anti-glycolytic agent, typically for glucose or lactate. And there's the potassium oxalate and sodium fluoride, and it's the same thing. So either way, the only thing is that you're using the anticoagulant here, so you're getting plasma. Then you also have a white top tube with potassium EDTA gel, which would collect plasma for molecular diagnostics. You have yellow, and there is two different types. There's yellow with sodium polyethanol sulfonate, which is the SPS tube, and that collects whole blood. That's typically for blood cultures, okay? So that's one of our first tubes that we collect after a blood culture bottle. Or we can have a yellow top tube with the acid citrate dextrose for white blood, in which we get white blood cells for HLA typing and paternity testing. Probably not something that you will see very often in our lab. The royal blue is for sodium with sodium heparin or sodium EDTA. You could collect either plasma or serum, and this is typically for trace metals or toxicology. The yellow marble or the orange top tube has a thrombin in it. Thrombin will help us collect serum, and it's for stat chemistry. And the tan color has potassium EDTA and helps us collect plasma. Typically, that's collected for lead testing. So in phlebotomy, we have a very important concept, which is the order of draw, okay? And so basically it tells us that we need to collect our blood in a certain way, because if we don't, we can cross-contaminate our additives. And we don't want to do that, because what's the whole point, right? You want to keep them in order so that we are not taking some additives from one tube into another to mess up our tests, okay? So the general idea is, what's the most sterile thing that you need to collect? And typically it's the blood culture, okay? So basically the blood culture is the testing that you do on blood to make sure that there's no bacteria, okay, in the blood. So you can't contaminate that, right? There's nothing that can be on that when you do the testing, okay? So that's one of the first things that we always look. We look for blood cultures. Do we need to draw them? If we do, that's what we do first, okay? A sterile tube, which is usually a blood culture. And if you're not doing the blood culture bottles, you're typically doing an SPS tube, okay? A yellow top tube, and that's going straight to microbiology, okay? All right, well, after that, if we do have to collect those, then we move on to the next step, which would be the light blue stopper. The light blue is typically the coagulation tube, goes to coag, it has sodium citrate, okay? So we cannot collect any other additive before that, because that is very, very there's a high potential of cross-contamination when you do that. So you want to do the light blue stopper right after your blood culture. After that, you can do red, or you can do any type of serum tube with or without a clot activator or a gel separator. After that, you can do either you could do a heparin tube with or without gel or plasma separator, or if you must do anything before that, you do a yellow SST or a PST tube. After that, you can collect the EDTA tube and any other tube with glycolytic inhibition or a glycolytic inhibitor in there, which would be a great type tube, a sodium fluoride tube. So carryover cross-contamination is basically it basically happens when you transfer an additive from one tube to the next. Okay, so it happens when blood in additive in the additive tube touches the needle during the evacuated tube system collection, and the blood is transferred from, or when the blood is transferred from a syringe into the ETS system. So basically, the order of draw presents a sequence of collection that minimizes the risk for interference should carryover occur. And also filling specimen tubes from the bottom up minimizes carryover as well. There's also tissue thromboplastin contamination because tissue thromboplastin is present in tissue fluid, and it activates the extrinsic coagulation pathway, which can interfere with coagulation tests. So for coagulation tests, other than the typical tests, which are the PT and the PTT, we want to draw a few millimeters of blood into another tube before we collect any coagulation specimen, because tissue thromboplastin, yeah, it can start activating the coagulation cascade, and so some of your results are going to be off. And we have to watch out for microbial contamination, right? So microorganisms found on the skin can contaminate blood specimens. So blood cultures are collected first in the order of draw when sterility of site is optimal, and also to prevent contamination of the needle. All right, so quickly, I just want to stop the share. Well, I'm going to stop the recording. I'm just going to show you a quick video. Okay. Stop recording.